endoscopists in the audience would have come across a scenario such as this, where a patient comes for an endoscopy for an unrelated indication and is found to have an incidental submucosal tumor. Biopsies are done, and they more often than not show normal gastric tissue, just because the biopsies usually don't go deep enough. CT scan is done, and is unable to provide a definite diagnosis, and sometimes is even unable to locate the lesion. EUS showed a hypoechoic lesion, which could mean one of many possible diagnoses. And the question arises, is this a GIST? Now, when we are suspecting a GIST, which is in quite a lot of these submucosal lesions, then there's a whole range of diagnoses, as you would see, ranging from lipomas, duplication cysts, inflammatory fibroids, polyps. But we're not that worried about the ones on the top. What we're worried about are the ones in the red on the lower part of the screen, the sarcomas, the carcinoids, and the GISTs, because these are the lesions with malignant potential, and it's important to know what we're dealing with. However, because of the difficulty in establishing a confident diagnosis in most of these lesions, they are just labeled as possible GISTs and keep having endoscopic surveillance. So we performed a retrospective cohort study of all referred to us for resection of these upper GI submucosal tumors between 2008 and 2013. And they were all referred to us with an unclear diagnosis and as possible GISTs. And they were all treated by ESD at our institution by one experienced endoscopist, and they were